Thank you for joining us this afternoon for our presentation of our 8-week series, Moving to an Assisted Living Community. I am Alexandra Ramsey, Director of Community Relations for the Kensington Reston, an assisted living and memory care community now open in Reston, Virginia. We are so pleased to have all of you joining us today and hope you'll join us next week for week 2 of How Do You Pay for an Assisted Living Community? We are delighted to feature today's guest speakers and aging life care managers, Vanessa Bishop, owner and founder of Elder Care Consultants. Vanessa founded Elder Care Consultants in 2001 as an interdisciplinary team that provides care management for the aging and disabled populations in Northern Virginia, Maryland, and Washington, D.C. Vanessa has specialized in aging life care management service since 1998. She was interviewed as a subject matter expert for the New York Times article, Deciding Care for Elderly Patients in Declining Health, because of her expertise in aging life care management and in the field of social work. We are also delighted to have Courtney Levander, owner and founder of Lighthouse Senior Care. Courtney is a licensed nursing home and assisted living administrator, a certified care manager, and a certified dementia practitioner. She has over 22 years of experience working in the long-term care field as an administrator, executive director, operating and managing nursing homes and assisted living communities, and working as an aging life care professional, geriatric care manager. She has a Bachelor's of Science and a Master of Science degrees in gerontology from the University of Southern California. Courtney has served as an expert witness in the Commonwealth of Virginia. Today's topic of discussion is, how do you know when it's time to move to an assisted living community? This presentation is in webinar format, so you are welcome to ask questions throughout and wait until the designated Q&A portion at the end for answers. We hope you enjoy today's presentation of how do you know when it's time to move to an assisted living community.
Thank you, Alex, and welcome everybody to our presentation today. We hope you find it very informative. My name is Courtney Levander, and I'm going to start the presentation today to give you some ideas as to when you should consider moving into assisted living. First and foremost, we always want to start by saying, looking at safety. If somebody is unsafe in their home, that is our #1 priority, is to keep them safe. Often individuals are living in their home and it becomes unsafe for them to live there independently or with their family member due to the living environment or some particular behaviors that might be going on in the home. The other option people consider moving to assisted living is because of the cost of in-home care versus assisted living. In-home care is far more expensive than assisted living and can range from $28 to $30 an hour for an hourly caregiver, and for a living caregiver from $300 to $400 a day. As you can see, that's markedly more expensive than a typical assisted living. Individuals also tend to consider moving into assisted living when they have family dynamics or they have caregiver burnout. They are helping their loved one in the home and are having difficulty caring for them independently and are needing more and more help. As individuals age, they also tend to have more circumstances arise needing multiple doctors, they have comorbidities, and it becomes more challenging to get individuals to those appointments. So moving into an assisted living is a nice option that provides an umbrella of services where you have in-house providers that come to the individual versus having the individual go out to the individual providers. Maintaining a home is also something that can be overwhelming for individuals as they age. Home maintenance, grocery shopping, transportation is all things that people need assistance with. Also, related to COVID, people are having difficulty socializing. So when individuals move into assisted living, they have more opportunity for cognitive engagement, activities, and socializations. So that's just a quick overview of when somebody should go and consider assisted living.
Hi, thank you. My name is Vanessa Bishop, and I'm going to talk about what is an aging life care professional. And an aging life care professional is a health and human service specialist that really focuses on serving as a guide and an advocate to an individual, such as a spouse or a power of attorney or a guardian caring for a loved one that could be an older adult or disabled adult, a disabled young adult. And an aging life care professional's educational background and work experience relates to the field of aging life care management. And the educational background can range from having a master's in social work, nursing degree, master's in gerontology, rehabilitation science, and much more. And an aging life care professional really has specialized training and experience, extensive experience in the field of aging life care management. And we have many, many community resources at our fingertips. I like to tell people that not only are we an advocate and we serve as a guide, but in particular, when we serve as a guide, we have very strong and extensive working relationships with community resources. And an aging life care professional is a member of an association that's nationwide called the Aging Life Care Association. About 6 or 7 years ago, we were known as geriatric care managers, but we were rebranded because we truly work with not only the older adult, but the younger adult. And our hourly fees for an aging life care manager can range anywhere from $150 an hour to $250 an hour. It truly depends on the jurisdiction. And we'll bill in increments of minutes. It can range from 6 minutes, 10 minutes, 15 minutes, and additional fees that might be applied on top of or in conjunction with services being rendered would be fees for travel time, mileage, or advance fees. But every organization is very different. So it's important to, of course, inquire about that when you're interviewing an aging life care association organization. So what does an aging life care professional do? We absolutely provide peace of mind and improving and maintaining one's quality of life.
So as aging life care professionals, we specialize in 8 areas of specific knowledge. We primarily do a lot of advocacy for individuals in various settings, whether they're at home, in the hospital, in the nursing home, and help make sure that their wishes are upheld. We understand what the individual wants. We understand what their physical needs, their mental needs, their social needs are, and we help advocate them for them in each particular setting. We also have specific training and understanding in legal issues. We're often brought in for cases of an individual going through a guardianship hearing. We're asked to do a formal assessment and might testify in court during that guardianship hearing. Crisis intervention can be a variety of things. An individual might have a crisis in the home, they might have a crisis in the hospital. We come in and help families during crises, trying to figure out what the next steps are, what is the appropriate environment for them, and walk them through the crisis and then make a plan going forward. We also help individuals with health and disability. Are they eligible for SSI? We assist them with finding specific providers. Financial, we help individuals with long-term care insurance applications, understanding your long-term care insurance policy, what is covered, when should you apply, talk through what that looks like. Oftentimes that can be a very confusing and overwhelming process for individuals. We also can talk through and help people understand the overview of when do you need to apply for Medicaid and refer them to specialists to do so. Housing alternatives, oftentimes people want to understand the different types of housing, what is available to them, an assisted living, a continuing care retirement community, skilled nursing, small board and cares. There's a variety of different housing options that we specialize. We can refer individuals to those facilities and help them make a educated decision on what would be best for them and their family. Family expertise, everybody has different situations revolving around their family. Some have unique circumstances and family dynamics. Some have no family at all. And some have family that are afar in California or possibly Hawaii that we support and are advocates for the clients here while still maintaining their family relationships and helping them understand what's going on with their parents and kind of stepping into the role, making sure everybody is clear on what their care plan is and helping them understand next steps if needed. Local resources is also something that Vanessa just touched on. There are a variety of different resources that people need when they age. Some people need home health care. Some people require caregivers in the home for private duty aids, home modifications. Individuals might need a stair lift or they might need some grab bars that are put in. So we do provide a vast array of services and recommendations with local resources.
So how an aging life care professional helps. Professional support. We absolutely provide professional support. And the first step that we take is we assess the needs of the client. We conduct what we call a comprehensive assessment, where we're assessing their physical status, their functional status, their nutritional status, understanding their past and present medical history. More importantly, or in conjunction, we do a comprehensive home safety assessment. And from that comprehensive assessment, also interfacing with the interdisciplinary team, informal and formal support networks, is we develop a plan of care, a treatment plan of care. And as Courtney was just highlighting on resources, again, links to services that we recommend that the individual or the power of attorney or the guardian consider as part of that treatment plan of care. We also mediate family conflicts. Quite often, when we are opening up a case, there is or are family dynamics or family conflicts. So we serve as a liaison, we serve as a mediator when it comes to family conflicts, but more importantly, provided active listening and understanding and validation in order to be able to mediate and move forward when there is conflict within the family. And I would say 90% of the time, or quite often, when our services are called, it does relate to crisis intervention. There is a crisis at hand. When Courtney was talking about, it's no longer safe at home. Someone's at imminent risk and is needing intervention right then and there. Monitoring clients is another service and part of the role that we provide. Through that ongoing assessment of an individual, because nothing is static. The care plan is not static, it's always changing and evolving. We're ensuring that the needs of that individual are met. The care plan needs identified are being met. And again, ongoing reassessment and monitoring, we're identifying changes and making necessary adjustments. For example, it could be that someone has private duty at home, but we're realizing that instead of having an aide Monday, Wednesday, and Friday, their care needs are increasing, and we need to implement the caregiver services Monday through Friday or 7 days a week, because components of their activities of daily living, such as bathing, dressing, feeding, toileting, and mobility, they're requiring more supervision or verbal cueing or prompting. One of the services and key components of us, Equality, is that we keep family members informed. I like to tell people to think of us as the central communication office. We're keeping family members abreast of what's going on, whether there's a change in their treatment plan of care, an improvement, or an unfortunate decline. And again, family members are very grateful for that, as well as the interdisciplinary team members, doctors, home health care, home care agencies. Ultimately, it provides a peace of mind for the family and the senior or disabled adult. And again, ongoing evaluation and adjustment to the treatment plan of care, because we're all changing and evolving over time. and coordinating care. Again, we're finding the best options for the client's situation. Again, that assessment. Is it safe for someone to continue to live at home? Is there desire to continue to live at home? If home is no longer safe, what is an appropriate alternative residential setting for that individual, such as assisted living? Again, serving as a communication hub is key, a big hat that we wear, because family members or even power of attorneys or guardians are overwhelmed with the requirement of reaching out to multiple disciplines to find an answer to a question. And we serve as that communication hub. And a big hat and role that we wear is that of an advocate. That is really a very significant role that we portray and provide on behalf of the senior to ensure, again, treatment plan of care, achieving and maintaining the highest quality of life. And again, new situations arise. The unexpected might occur. And so we are there to assist when new problems arise, whether medically or psychosocially or environmentally, or even if it's a family dynamic, and truly much more.
So you may be wondering what to do when you need help and what those various situations would look like. Oftentimes people need help when they have a new diagnosis. Maybe they have a new dementia diagnosis, Parkinson's diagnosis, cancer diagnosis, or they're just worried that your mom or dad has a little bit of memory loss. They're a little more confused. Are they refusing help and you've talked to them about their situation and you don't know what to do or what approach to take next? Do you need an advocate? Do you have a new diagnosis and you're struggling getting to the next step, getting to that next provider, making your appointments? These are all examples of when we can step in. Medical care and caring for a loved one as they age is very confusing. There's lots of moving parts, and navigating the medical system is what we do every day. And we help make that confusing system less confusing, and we manage that for you. Again, everybody has a crisis eventually and at times, so we are there in those times of need, whether it's a crisis in the home, an individual has fallen and now they're in the hospital and we don't know what to do, or there might be a new family dynamic that has come about and we don't know how to resolve it and we need an outside person to come in and look at things from a different lens. So those are all some examples of when you would hire an aging life care professional. And Vanessa and I are going to go into a few details and do some case studies next to give you a little more understanding of what some of these situations might look like.
Okay, so the first case study, I'm worried about my mom. And again, very common situation or case where we're called upon. So in this case study, mom is in her 80s. She's widowed and lives alone. Daughter lives far away and is worried. Daughter is calling mom and mom is saying she's fine, but the daughter is sensing some cognitive changes in her mom. She feels her memory is failing. There's some short-term memory impairment. The neighbor is beginning to call the daughter and expressing the concern because the neighbor's been going into the house and she's seeing that the daughter's mom is not consistently taking her medications. It could be that she has medications in a pill box and the days have not been utilized, or the meds taken, or blister packing medication, which would have the date of the medication and when it's to be administered. The neighbor notices that the mom is losing weight, her clothes are baggy on her. It could be that the daughter is Zoom calling mom or FaceTiming her and she herself sees that mom has lost weight. The daughter overall has a sinking feeling that something is wrong in her mom. There's absolutely been changes, but at the same time, mom is verbalizing to her daughter that she wants to stay in her home as long as possible. So mom is at risk, and overall there are grave concerns that we as an aging life care professional can help. And again, the first situation is first step is actually conducting that comprehensive assessment where we are going, and now with vaccinations and still with COVID precautions, we can go into the home setting and evaluate mom, doing that comprehensive assessment I talked about before. But again, communicating with the daughter, communicating with the neighbor, and any other informal support networks. And when I say formal support networks, it could be an attending physician. It could be a home care agency rendering private duty, not home care, but like home health care. It could be someone from church. That would be an informal support network. And again, the ultimate goal is to maximize the mother's independence within the home setting, but implementing the appropriate care plan recommendations, such as private duty or additional skilled services into the home, to ensure her safety, her general welfare, and achieving the highest quality of life and maintaining that quality of life within the home setting. And again, having those resources and working relationships with organizations in the community and being able to bring them into the home setting for the mom and educating the daughter and/or the daughter what's covered under health insurance, what might be out of pocket, what might be utilized by a long-term care insurance policy is a great benefit. And so mom is happy because she's in a familiar setting. She is comfortable within her home setting. In particular during COVID, many, if not most, want to remain in their home setting. And the daughter is also relieved because she is not local and she knows that there's a healthcare professional and an advocate and who will also be on call if something unexpected, an urgent nature, an emergency situation arises. That care manager has a comprehensive understanding of that individual, their treatment plan of care, their goals, wishes, and desires. And the daughter and other involved party members are very relieved that they can know that they can go to that aging life care manager. And we provide long-term care management as well as short-term care management. So we are able to provide ongoing monitoring and reassessment and assistance as needed.
The next slide is, I don't have anyone anymore. We are finding this situation more and more prevalent about individuals who either are a recent widow or they were never married and they don't have any children. We're also seeing couples who don't have any children want to have a plan come in place. So this specific example is a retired nurse who is now widowed. She has no children and she feels all alone in the world. She doesn't know what to do and there's nobody there advocating on her behalf. With COVID, we've gotten an increase in this situation to say, what would happen if I get COVID? Who is going to be there? Who do I call? So in this situation, we would go into the individual's home, meet with them, have a consultation and discuss what are your needs, understand their current situation, their medical providers, their health care, their medication, and provide an emergency plan for them. Coordinate help with professional services if needed, accompany them to the doctor if needed, or stand by. We would also set up a care plan that would involve us checking on that individual on a regular basis, whether that's via Zoom, in person, and that would vary based on their care needs. We would provide them ongoing monitoring as their care changed and assistance for them. We step in as an extended part of their family and would become a real support for them in this situation. We would have extensive conversations with that individual about what they wanted. Do they want to remain in their home? If they were to have a terminal diagnosis, what would that look like? We would talk about what current conditions that they have and what is their plan, what are their wishes for, how do they want to be treated, and walk through various situations to make sure that we are in the proper position to advocate for them all the way through the end of life, and then set up a plan to do so.
So the next case study is Dad's memory isn't what it used to be. My father is stubborn and it's gotten worse since his memory began failing. And we see situations where the individual has had a behavioral disposition before, let's say, a diagnosis of dementia. And the dementia over time exacerbates that behavior, whether it's stubbornness or anger or just an agitated person. And in this case, the father is refusing to quit driving despite getting lost in familiar places. The family's very concerned about driving. Should they disable the car? Should they contact the Department of Motor Vehicles? Dad is refusing to see a doctor. Dad is refusing to take medications. They are seeing that bills are piled up. Taxes are not being paid. Utilities are about to be shut off. And this is truly a crisis intervention case where services and intervention is imminent because the person is unfortunately and unintentionally self-neglecting, or to a degree is intentionally self-neglecting because of the stubbornness, or could be in denial, or all of the above. But where an aging life care professional helps, again, is meeting with the family members, sitting down with loved ones that are actively involved with the individual as a loved one, as well as observations or concerns expressed by outside family members or friends, or informal support. Again, active listening, understanding, and really doing that comprehensive assessment, potentially very creatively and gently because of this gentleman's behavioral disposition, and providing education and support to the individual, to the senior. You know, client's right to self-determination, we want to try to involve the individual as much as we are able to. And again, provide the education and support and care plan recommendations to the individual as well as the family member, wanting to work with the dad and the family member to try, hopefully, to come to a mutual agreement, understanding and agreement. If dad is going to stay home, these are the recommendations ultimately for him to safely stay home. Is it private duty in the home? Is it a live-in? Is it bringing a house calls doctor into the home setting? Is it to bring skilled services, physical therapy or occupational therapy into the home setting because they're debilitated because of unintentional self-neglect? Bringing in a CPA or a daily bookkeeper or money manager, and recommendations for any other specialist. Again, cognitive changes. Do we recommend that they see a neurologist, and who do we recommend? And there are situations, such as in this case, where the individual says, I don't want someone living in my home. I don't want someone I don't know. I don't want someone following me around from room to room in my home setting. Or it could be that the cost of care can't be afforded in the home, that it's more financially feasible to move into assisted living. And we as a care manager would highlight the benefits of moving into assisted living, the medical services, the degree of custodial care services that are provided, the social and recreational services, and in particular, that he doesn't have to drive if he were to move into assisted living, the shuttle services, the transportation services that would be provided in an assisted living facility. And we can help with the assessment, the triage process for when an individual such as the father really wishes to consider and explore assisted living, and the move-in process, as well as monitoring post the move their transition into the assisted living facility to ensure a comprehensive interdisciplinary treatment plan of care with ongoing monitoring as they transition to this new home of theirs. And we can continue to help in multiple aspects of that individual while residing in assisted living, as well as supporting the family and loved ones, again, in the community.
And these three examples are not just, they're not the only examples that are out there. There's a lot of other examples that individuals go through. We get involved and start talking with individuals when they have new dementia diagnosis, if they're experiencing memory loss. We help individuals in the early stages understand and cope with the diagnosis, help families understand what to expect, do a lot of education with them, talking about a plan, discussing when is the right time to move into assisted living? What are your options? What does it look like? Do you want a continuing care retirement community that has multiple levels of care? We also are seeing an increase in substance abuse and mental illness in our seniors, and especially with COVID, that has really been exacerbated. We often get involved in those cases and refer individuals to assisted living at that point to have a more comprehensive overview and an individual setting where they can still have their own independence in their individual apartment, but have a support team around them to help them through their current situation. Vanessa just did a great presentation on individuals refusing help. What do you do? Is the individual sabotaging themselves? Do you have a family member or a neighbor who is potentially sabotaging next steps with a individual? We can certainly step in and assist with that. Also, in the last year, we have come and helped people with pandemic plans. What do you have a plan if you're caring for your mom or your dad at home and the primary caregiver gets COVID? What are you going to do? Who's going to provide that care? What happens if one of the spouses goes to the hospital and mom with Alzheimer's or dementia is left home alone? We help individuals set up that plan to include a possible respite stay at assisted living. So these are all various other scenarios that occur on a day-to-day basis that we get involved with.
So when to refer to an aging life care professional, and this is a pretty hardy and extensive slide here that I'll go into detail on. First, your concerns go beyond your expertise and ability to help. Quite often we see a loved one assuming the role of a nurse, a social worker, a doctor, a financial advisor, a lawyer, and a full-time caregiver, AKA caregiver burnout. And we are quite often called upon to assist the individual because the concern at hand, the medical matter, the crisis situation is truly beyond their expertise and they are overwhelmed and truthfully burned out. Another example is when the client and family needs information about community resources. Again, goes back to our working relationship and very comprehensive understanding with community resources. Again, alternative senior communities, home health care, home care specialists such as neurology or psychiatry. If someone is homebound trying to bring services within the home, whether it's phlebotomy, mobile x-ray, a house call doctor. Quite often we get phone calls where someone will say, I think I need some home care because I alone can't care for my loved one, but I've got a list of 75 organizations and I have no idea who's reputable and who I should be utilizing or what's the cost component or how to even begin this process. Another example is client has little or no support from local family members. And that could be a situation where there's family dynamics and where a child is estranged from their loved one. And that senior really needs that advocate, that educator, and that guide and that liaison to be able to guide them on this journey and to be a support for them. Client keeps on falling through the cracks and needs an advocate. An example would be rehospitalization. Someone is in the hospital, they are discharged back home, supportive services are not in place. Again, whether it's a visiting nurse, physical therapy, occupational therapy, or private duty aid services in the home setting, the inability for them to coordinate medical appointments, follow-up appointments in the community, and they decline and they're rehospitalized. Another is that we do get individuals where there's concern about their ability to afford housing, whether it's a group home, assisted living, or long-term care nursing, and really peeling back the layers of the onion to understand both their health insurance and financial situation so that we are able to safely and successfully relocate them or move them to a setting so they don't fall through the cracks and they're not at risk. Client and family needs unbiased information. I'd like to extend that also to elder law attorneys. Quite often we are called upon to come in and do a comprehensive assessment. For example, it might be a guardianship case where an elder law attorney calls upon an aging life care professional that assesses the whole situation, does a comprehensive assessment, but also assesses and opines on their cognition, their ability to independently make medical and financial decisions on their own, what we call a capacity assessment, and really being that neutral third-party healthcare professional that will come back and provide their assessment, their impressions, and their care plan recommendations, or the recommendations, for example, as to whether or not a guardian in conservatorship should be pursued. Family disagrees about next steps. Again, we do see quite often family dynamics and disagreeing on next steps, such as should my loved one move into an assisted living facility or staying at home, or if someone is in a nursing facility and they are on hospice and family says, I want to bring them back home under hospice versus continuing to reside in that long-term care nursing center. There are instances where they disagree, and that's where, again, active listening, understanding, validation, and education, and laying the foundation and steps moving forward to be able to come to a cohesive or mutual agreement about what is in the best interest of the senior and the steps to be taken to achieve that goal. Caregiver feels overwhelmed and unable to move forward really applies to that caregiver burnout, assuming too many roles. Feelings of guilt, feelings of sorrow. Could be a marriage where one spouse was the alpha in the marriage and the other one was not, a codependent relationship. So they feel overwhelmed and out of water because making decisions on next steps can be very uncertain or overwhelming for them. So again, holding their hand, listening and guiding them and providing positive reinforcement and support is crucial. Client needs oversight of existing care. Again, we have seniors as well as young adults where they truly benefit from continuous care management from an aging life care professional. Again, care plans, treatment plans of care are not necessarily static because we're all evolving and changing. And there are family members or power of attorneys that are not local, where in addition to the client, they too need us to provide that ongoing oversight and monitoring of their care. One of our roles, because as an aging life care professional and a member of the association, is that we have a strict code of ethics and standard of practice that we must abide by. And we are mandated reporters so that when we assess a case and we see abuse, neglect, or let's say financial exploitation, we are mandated reporters and we must report that to the authorities such as Adult Protective Services. So those are just a few examples of when to refer to an aging life care professional.
We also wanted to touch a little bit on today about some of the trends that we're seeing in the industry, specifically in the last year, because our whole industry and everybody's lives have changed in the last year. We're seeing an increase in individuals with addiction, drug addiction, pain pills, alcohol addiction, and an increase in mental illness. COVID has really exacerbated these situations, and there is a high increase in our seniors who are experiencing mental illness, addiction, and the families don't know what to do. So we provide support for the individual, the family, give them local resources for crisis intervention, the CSB, things like that. We're also seeing a trend where families with disabled adults who live with their parents and have been living with their parents for years. These adults might be in their 50s and their mom and dad might be in their 80s. We go in initially caregiving for both mom, dad, and the child, or mom and the child, and the parent passes away. And now we are dealing with the disabled adult and helping care manage the disabled adult and finding assisted living or group homes for that individual, being their advocate as well. We're seeing a lot of families who are in this situation who may not already have a plan or a special needs trust coming to us and helping, and we will advocate for them, talk them through what specific steps they might need, refer them to an elder law attorney who can help them draft a special needs trust for their loved one to ensure that they're cared for. Early onset dementia is something that we're seeing an increase in. We're seeing individuals in their 50s and 60s being diagnosed with memory impairment, with dementia, and the age is getting younger and younger. And we have family members who have young children at home, a sandwich generation, and now they have a spouse who is exhibiting behaviors that are leading towards a dementia diagnosis, and then eventually they are being diagnosed with dementia. So we're helping those families walk through what does it look like to be young and to have younger children who might still be residing in the home, and help them set up a plan and help the whole family understand the disease process, what to do, and how to cope with their parents and their spouse in this very difficult situation. We touched a little bit about frail elderly people who are fully functioning in their home. They've been living independently. They've been living in their home maybe 30 or 40 years, but they are resistant to moving, accepting help, but they are starting to show that they do need more help. Vanessa touched on that quite a bit. The baby boomers, the family members are finding resources online. Everybody's very good at Googling and looking up resources for their aging parents, so that's a new trend. Telehealth has changed the medical industry tremendously. COVID precautions and preparation is something that is continuing to evolve and is something that I think will continue in the future. One of the other trends, especially in the beginning of COVID, was how do you create a virtual assisted living or skilled care in the home? That is something that is still continuing to evolve.
So choosing an aging life care professional, again, we have a national association, aginglifecare.org. And there are organizations, care management organizations out there that are not members of the Aging Life Care Association. And so when you're seeking an aging life care professional and you call a company, it's a benefit and importance to ask if they're an Aging Life Care association member. And when you find out whether they are or are not, it's also, and hopefully they are, you want to ask about their certification. Are they a certified care manager? Do they have certifications in other areas within the health and human services field or healthcare arena? Within our association, there are various levels. You can have a certified fellow, you can have an advanced professional, or professional level under the care management arena within the Aging Life Care Association. Again, asking about licensure within the organization. Is it a licensed clinical social worker? Is it a licensed nurse? Of course, asking if the company is licensed is important. A biggie is responsiveness, or being responsive. From the time in which you call to learn about the services, also about working hours as well as after hours. Some organizations focus on working during the working hours, and some care management organizations actually are on 24/7. So it's a really good question to ask. In addition to a lead care manager, a backup care manager, the on-call services, finding out the years of experience of that organization, but the care manager themselves, the aging life care manager themselves, and also the knowledge area of their background, their work experience, their educational background that I highlighted in the beginning. It's important as you are presenting your concern or situation of your loved one that if it's a matter of, let's just say, critical care or a chronic situation or an acute situation, a comprehensive or complex medical care, are we looking at a RN care manager? If it's possibly a Medicaid related issue, would that be, or placement, would that be something more along the lines of a social worker or hospice? It's also important to ask about the knowledge of the local area, the vicinity that they practice in, their knowledge base, again, the resources, and the services provided by the aging life care professional. Under the association, when you actually get onto the website and you can find an aging life care professional, there will be a section underneath the name of that individual organization that might say consultation, guardianship, conservatorship, placement, insurance related matters, counseling, and much more. And again, understanding the services provided, because it's imperative that when you retain the services of an aging life care professional, the services being provided is meeting the concerns or the needs of that very situation, on top of the qualifications of that care manager, their responsiveness, and much more. And also the fee component. Ask about fees. Every organization is potentially going to be a little different in their billing. We are an out-of-pocket cost, so health insurance does not pay for aging life care professionals. It's predominantly an out-of-pocket cost.
And this right here is an example. If you go to aginglifecare.org and are looking for an aging life care expert, if you click on the orange button that says find an aging life care expert, it will bring up a prompt and you can put in your zip code and it will give you, you can select the mileage range and it will let you know all the different aging life care professionals in your local area that you can contact.
And that's, yeah. And that's our presentation. So if anybody has Q&As, questions, I believe that they can type them in. I think we have a few more minutes.
Yeah, I actually have a few that have been sent in privately, so I'm going to speak to those quickly, and maybe we can get some answers for them. The first question is, what services are covered by health insurance within an assisted living setting?
I'll go ahead and take that one. So in a assisted living facility, assisted living is typically private pay. There are a few low-income assisted living communities that are subsidized by federal programs and county programs, but primarily the room and board and care services are paid by the individual. Sometimes individuals' long-term care insurance can assist with that if they meet those qualification needs. The nice thing about assisted living is you have an umbrella of services. You have doctors that come to the community, for example, primary care physicians, podiatrists, ophthalmologists, psychiatric services. They all come to the community, so the individual does not have to go out of the community to receive those services. Those individuals under those umbrellas are able to bill somebody's private insurance, for example, Medicare, a secondary insurance. So in general, the basic fees for assisted living are not covered by Medicare, but the services being brought in by individual providers can be covered.
Okay. Thank you for that, Courtney. Another question is, are tours being provided currently in assisted living or not, or are they virtual? Vanessa, could you speak to that?
Sure. So it's really a combination. I mean, since the vaccination has been, or vaccines have been being administered, and we're building herd immunity in the communities, as well as outside of the communities, assisted living residential settings, some are allowing tours throughout the unit. Some are creating a model room that they have the individual tour as well as like a virtual or a video that they're watching while they're in the room. And most of them at a minimum are going to be providing a virtual tour that you can access from, you know, your laptop or your computer. But we are seeing more tours being conducted creatively within that senior residential setting with the necessary COVID precautions, of course, being taken place.
Great. And to that point, additionally, are respite stays being provided during COVID, Vanessa?
So assisted living communities, whether it's traditional assisted living or even assisted living memory care, some of them are offering respite stays. However, given with COVID, and as Courtney was just highlighting just a few minutes ago about really there's a strong drive and a continuous drive to create the virtual assisted living at home or subacute rehab at the home. You know, some people are choosing to do respite. My recent experience is it's more on an emergency basis. However, some people are doing it with the intention or the hope and the desire that the individual will transition into long-term into that assisted living facility. But we do, again, with COVID, we've had a lot of caregiver burnout, and they do need to place their loved one under a respite stay.
Okay. We have 2 more questions. Who makes the determination on approval for admission to an assisted living? Is it a team approach or more of an assessment process? Courtney, can you speak to that?
Sure. Ultimately, the final decision lays in the hands of the community that the person is wanting to move into. Everybody does take a team approach in the assessment. The family, the resident, the aging life care manager, and the community all work together collaboratively to make sure everybody understands what the person's needs are and can they be met. It is the facility's responsibility to make sure that that individual meets their regulations, that they're able to move them in and be in compliance, and that they can meet the physical, mental, and social needs of the individual.
Okay, great answer. Thank you. And then the last question that we have, when would it not be appropriate or in the best interest of my loved one to have to reside at an assisted living community? Vanessa, can you speak to that?
Sure. And in the beginning, Courtney had highlighted on that, you know, a clear example of when home is no longer safe is when they're at imminent risk to themselves. And for example, the gentleman, the father who was very stubborn, hypothetically speaking, he's refusing private duty in the home. That's going to be an example of when we need to seek alternative placement, when the cost of care and the home exceeds what can be afforded, and a assisted living facility, whether it's a licensed group home or assisted living residential setting or facility, is less expensive. Again, caregiver burnout. You know, we have seniors, and rightfully so, that are tired of the upkeep of a home. You know, maintenance and home repair and coordination of appointments and transportation and meal preparation and laundry and housekeeping. That's another good example and reason for when people begin to consider assisted living. And also the skilled component, the medical component, the healthcare component, what is provided in-house. There's truly an abundance of services that are provided that gives peace of mind to the senior as well as to the loved ones that are you know, concerned or you know, very caring of their mother or father or senior. And again, the social and the recreational component, the social stimulation and the interaction. You know, at home, people have become isolated because of COVID. So it's very difficult to bring in, you know, the robust recreational component that assisted living, I would say in particular pre-COVID, and what's gradually being re-implemented into assisted living facilities now provides.
Yeah, and I just wanted to further touch on that. You were talking about the component of dining, life enrichment, housekeeping, laundry. I think there's a common misconception, at least from what I've experienced, that people think that there has to be assistance being given to live within assisted living. So even at our community specifically, we have residents who just, again, to your point, Vanessa, want to move into the community based upon the fact that they want more socialization. They don't need true physical assistance, but they can live within our community setting without having to receive hands-on care. They want, that lifestyle of living where they're not having to do laundry and cook 3 meals a day and, have that socialization, especially, so important with COVID currently. So thank you for touching upon all of those, those subjects.
We have situations where it's a couple and one needs to move into, let's say, memory care, and the other spouse does not. So it's not uncommon to see a spouse move into traditional while the loved one is in the memory care component to be close together too.
Right. Well, great. Those are all the questions that we have from the people who are participating today. So from the Kensington Reston, we want to thank both you, Vanessa and Courtney, for being here today, for giving us all of this great input on, aging life care managers, who you are, how you can really guide people in the process of moving to an assisted living community, to receiving services at home. And we just appreciate everything that you're doing. And we're so lucky to work with you both. And we look forward to having you on again sometime soon. And we will hope that the rest of you will join us next week again for our second week of our 8-week series, which is How Do You Pay for an Assisted Living Community? We will be featuring Tracy Shen and Kristen Dolan, who work with financial management and long-term care insurance. So we will see you next week, next Thursday, the 25th from 12 to 1 p.m. And thanks again, Vanessa and Courtney. We appreciate you.
Our pleasure. Thank you.
Bye, everyone. Thanks.
Bye-bye.
Bye.